So we have with us Dr. Sachin Tapaswi from Pune. Dr. Sachin, obviously you are one of the most accomplished knee surgeons of the country. What do you feel about this concept of the meeting? We obviously have had no live surgery, no lectures. What do you feel about the meeting?
So I think, Raju, there are meetings, there are congresses, there are symposia, there are workshops, and there is a master class. The name says it all. It is a very unique concept where we have not the usual technique-based or let's say issue-based discussion, but it's more of these challenging cases that we see in our clinic. And I think we can actually put them down into two different compartments. One is a common problem which presents in an uncommon fashion, or it's a totally uncommon problem which completely sort of puts us off on that day where we really are completely perplexed as to what we should be doing. And for all of these, Raju, there are no rights and wrongs. It's not a binary concept where there's a 1 and a 0, but I think this masterclass series is all for those in-betweens which lie outside the bell curve, where one has to stretch their imagination. And the main important aspect of this masterclass is that it gives you a perspective and stimulates your learning and thinking in such a fashion that you start looking at all the various skill sets that you've picked up over several years, and then you just package them into a fantastic box, and then you give them to a great room of surgeons who have got, if you look at their combined years of experience, it's a humongous amount of experience in that room, which really translates into fantastic discussions, deliberation, exchange of thoughts, ideas, and what you culminate back in is a completely enriched personality which you can have in 36 hours.
So we are honored to have Dr. Sheetal Gupta, a very senior arthroscopic surgeon from Bhopal. So Dr. Sheetal, I wanted to ask you, what was your experience in this program?
So this is one of the different course from the routine course. This is typically what is named as a master case series. So you see, this course is a different because all the top faculties from all over India are gathered together and they are discussing their cases. And the interaction that is being happened here is it's a totally different experience because you learn a lot of new things from a different perspective, which is not there in any other conference. So I think this master course has given me a different perspective of all different kind of surgery. There were a number of complicated cases which masters have managed. So you learn from every case. So I think this is more of an all faculty program, and it's a closed group program, and with a lot of interactions and a lot of discussions.
Right. Yes. Thank you for coming for the meeting. What do you think about the concept of the meeting?
Honestly speaking, this is a very innovative concept. I like the concept, especially the discussions which happen after the case presentation are very encouraging because we get a lot of new ideas. So even after doing so many years of practice, going back into class always is helping us to improve our patient care.
गुड मॉर्निंग डॉक्टर, आपको इस मीटिंग का कॉन्सेप्ट कैसा लगा?
मीटिंग का कॉन्सेप्ट बहुत अच्छा है क्योंकि यहाँ आके आप अपनी जो नॉलेज है उसको अपग्रेड करते हो। आप ऐसे केसेस के बारे में डिस्कस करते हो जो बहुत रेयर केस होते हैं। जनरली जब ऐसे हमारे पास प्राइवेट प्रैक्टिस करते हुए केस आते हैं तो एक ही सर्जरी के बहुत सारे ऑप्शन होते हैं, तो हमें पता नहीं होता कि हम किस चीज़ को फॉलो करें। तो ऐसी जो मास्टर सीरीज होती है उसमें हमारी जो क्लैरिटी है वो काफ़ी हद तक सही हो जाती है केसेस के प्रति।
So we have with us today Dr. Peda Jayaprasad from Hyderabad, a very senior orthopedic surgeon, who's going to tell us how did he find this program.
Yeah, this is a very wonderful program. I feel this program has to be in a like a bigger conference type of thing, making on each topic with the very experienced faculty. So very interactive, and ARS and other things are very good, and the people will analyze the topic and question and take out the answer from the seniors, and this is a wonderful program.
So, Dr. Sunil, how do you think the concept of the meeting is?
It's a pretty unique concept in that we don't see such kind of discussions happening in bigger meetings as such. This is more like a very, very focused discussion on certain aspects of arthroscopy which you don't get to discuss in big meetings. And I must say that even for a person who is doing arthroscopy on a very regular basis, these things are bouncers in the sense that you come across these things pretty rarely, and then you need to have some kind of a reference point. I think in that way it's a pretty unique and a pretty useful meeting.
So here we are here with Dr. Mukesh Ladda, a very senior orthopedic surgeon from Nagpur, and we want to ask him these two major questions about MCS. So sir, how was your experience in this program?
Hi Vikram, thanks for giving me an opportunity to come to this, the most academic event I have attended so far. The best part is we all are senior surgeons who are attending it, so we have certain understanding of various pathologies of the knee, and we all are dealing with those pathologies, but we all have different views and we all are giving results. So adding to all our views, it's going to improve us very well. So the way we are discussing a simple patella issues, you have derotation osteotomy, you have different concepts of TT-TG, you have distal proximal tibial osteotomies, you have TTOs, but what we got to know is when to implement and how to implement. We all know this, we are doing this since long, but one pathology giving, different pathologies giving rise to one problem, that is instability, but different ways of managing. And most importantly, we are sharing it like a friendly manner. That was a very good take home, that we all are senior orthopedic surgeons who are dealing here, but so friendly, taking each other's advice so that ultimately we can give best to our patients.
So bringing everyone on one platform helps.
Mr. Gray,
Hello.
Thank you for coming.
My pleasure.
And gracing this meeting. What do you think about the concept of the meeting?
The concept is something I've really enjoyed. Having these cases brings it to life. It's something we don't always get to see in meetings where the discussion concentrates on the science. We see a lot of tables, we see a lot of graphs. Here we see real cases executed, and then the science comes in when we talk about it. So there's so much time to discuss, and this is where the debate happens, but all in good spirits, I've noticed. So everyone's happy to talk.
Excellent.
We are delighted to have Dr. Kanchan Bhattacharya from Kolkata, one of our mentors and father figures in arthroscopy, the past president of Indian Arthroscopy Society, and so much more. Kanchan, thank you very much, first of all, for joining us. I think you've been part of both the editions of the Master Case series, or at least the very first one where the knee was the topic. So you've seen how we have evolved. I would value your honest views on the format, nature of the format. We obviously don't have lectures, we don't have live surgeries, but what do you still feel about this kind of a format for this meeting?
I think going for the first one, your idea was kind of path-breaking. You wanted to showcase more like complications. It probably would have started with some of our failures, which would attract our views on how things were made. And I think a good thing with many people will not agree is because we are not sticking to time. And I think time is of very little essence here. We are committed people. Nobody's walking out. It doesn't matter if we're taking a few minutes or even half an hour longer. And the discussions that are being held with no holds barred, that really adds value to what's happening. And I'm sure as it goes along, you'll be able to moderate the questions in such a way that it will glean out exactly what the vast majority wants to know. But